Hello, this is Dr. Bob DeMaria, the Drugless Doctor, with another get-to-know video just for you. Did you wake up this morning with digestive distress? How about in the middle of the day? Or just for whatever reason, you may notice that your colon is really starting to bother you. And it gets irritating, doesn't it? Yes, I know. I have patients that come into the office all the time and they just want to know what to do to help stop their irritable bowel syndrome. So let's talk about it a little bit. This is what I'd encourage you to do. Diet journal. Journal what you're eating and see if there's a pattern. Now, there are about 3 or 4 items that I see that regularly will irritate a person's colon. Number 1 is dairy products, and that's dairy products that could be in any type of food. Oftentimes what I'm seeing with our patients, they don't have enough digestive enzymes. You can see their pancreas is exhausted and their pancreas creates enzymes. What exhausts the pancreas? Eating refined foods, because your pancreas has to work harder to secrete the enzymes to process the foods. So you may consider going to a healthcare provider, go to our website and get a pancreas support or pancreas supplement. It'll make all the difference in the world. Now, dairy products can be in sour cream, yogurt, cottage cheese, ice cream, could be even in certain salad dressings. So just watch and start reading ingredients. Probably the more subliminal or stealth reason that we see individuals have irritable bowel syndrome is gluten. Gluten is in rye, wheat, oat, and barley. I want to throw this out to you. Barley is what they use for caramel coloring. So somebody right now could have chronic bowel irritation because they have a passionate addiction to soda, and soda has caramel coloring in it. So that's one of the reasons that you might be consuming something that does not even seem related to your colon problem, but we can trace it back. We can have a test done to you called the Adrenal Stress Index. It's a saliva test. The Adrenal Stress Index is a way for us to analyze your saliva, but there happens to be a portion of it called gluten. Gluten is part of the makeup of gluten, and we see chronic fatigue syndrome oftentimes because of gluten, which can come from gluten. So irritable bowel can be caused commonly by dairy, can commonly be caused by gluten products. We also see irritable bowel syndromes in individuals who have a leaky gut syndrome. See, your colon wall should be solid, but when they have little holes in them, like these holes here, like a sieve, undigested food particles can go through those intestinal walls, and your body sees those as foreign invaders. But the question is, what's causing the leaky gut in the first place? What I found from my experience, oftentimes it's not enough oil, especially omega-3 oils. So if you do not use oil, you stay away from oil totally, you're on a no-fat or a low-fat diet, that's not really good. I'd encourage you to take 1 tablespoon of flax oil per 100 pounds. I would encourage you also to use coconut oil, 2 tablespoons throughout the day. You may consider a marine-based oil like anchovy or sardine oil. Probably one of the most significant things that you could do is have an essential fatty acid blood spot testing, and you can do this in the comfort of your own home. We have kits available on our website that we could send to you, and we could determine exactly what oil deficiency that you have. As a side note, oftentimes I know that 30% of the ladies who are watching me right now worldwide have a deficiency in zinc. If you don't have enough zinc, your body cannot use the oil to help take away the inflammation in your body. So irritable bowel syndrome is oftentimes just inflammation that's occurring. One last thought is I have had individuals who consume diet soda. There's a chemical in soda called sodium benzoate. Sodium benzoate can cause allergies inside of your body, which irritates your colon, which causes inflammation, because irritable bowel comes down to inflammation inside of your body. So be aware, go back, and diet journal what you're doing and seeing what kind of pattern that you notice. My name is Dr. Bob DeMaria, the Drugless Doctor.